Welcome to our PRV dental video about pinhole gum surgery. What are the benefits of pinhole gum surgery? It is pain-free, minimally invasive, and offers a more symmetrical gum line than traditional grafting. Watch to learn more about this alternative procedure. You'll also discover the risks of pinhole surgery, including a high recurrence rate. But is it the right option for you? Let's discuss the pros and cons of pinhole surgery. Pain-free. If you are considering a gum grafting procedure, pinhole gum rejuvenation may be the right option for you. This minimally invasive procedure requires fewer steps than other gum surgeries. It can even correct a couple of teeth in about 20 minutes, with little to no downtime. Most patients can return to normal activities on the same day. Afterward, the pin-sized hole is almost invisible, allowing patients to return to normal activities quickly. In a pinhole gum rejuvenation procedure, the doctor will create a small hole in the gums the size of a ballpoint pen tip. The collagen will then be placed through this hole. This procedure involves minimal pain and requires no stitches or incisions. The pin-sized hole heals within 24 hours, making it an excellent choice for those who are afraid of dental procedures. After undergoing this procedure, your mouth will feel much better. This minimally invasive technique was developed by Dr. John Zhao, DDS, and has been widely adopted throughout the world. It is a painless alternative to traditional gum surgery and has been featured in international journals. The process does require an accurate completion by a trained and certified Pinhole Academy graduate. The procedure can be performed in one office visit. In most cases, the process is completed within one visit. After your treatment, you can resume your normal activities immediately. Compared to traditional gum grafting procedures, pinhole gum rejuvenation is virtually pain-free and does not require scalpels. There is no need to harvest gum tissue from a donor. The surgeon uses specially designed instruments to loosen the gum tissue, reposition the gum, and cover the newly positioned gum with collagen strips. Collagen strips help the gum tissue recover from the procedure without stitches. They will also strengthen the newly placed gum over the exposed tooth root. Minimally invasive. If you've suffered from a receding gum line for a long time, then you may benefit from pinhole surgical technique. This minimally invasive procedure uses a pinhole-sized hole in your gums to stretch them over the exposed root. Collagen is then used to anchor the gums in place. The procedure can be completed in just one appointment and requires no downtime. Many patients are able to resume normal activities immediately after the procedure. The Zhao pinhole surgical technique, invented by Dr. John Zhao, is an innovative and safe alternative to traditional gum grafting. There are no stitches, sutures, or bleeding afterward. Patients experience virtually no pain and virtually no downtime following this procedure. The technique has been featured on many television programs, including NBC, ABC, and 240 local TV stations across the United States. Dr. Amato is one of a select group of doctors nationally who have been personally trained by Dr. John Zhao, the inventor of the Zhao pinhole surgical technique. Patients who are in good health and don't smoke are great candidates for pinhole surgical technique. They should also be free of periodontal disease and have plenty of gum tissue. Without enough gum tissue, the procedure will not be successful. It is also not recommended for people who smoke or have extensive periodontal disease. Aside from smoking and other conditions, pinhole surgical technique is not recommended for people who are too young or too old to undergo traditional gum grafting. After preparing the mouth for the procedure, Dr. Kinder will administer a local anesthetic to numb the area. He will then insert a special dental instrument through the hole to loosen the gum tissue. Next, he will place collagen strips under the gums to support the gums and promote healing. The results will be visible on the same day and patients can return to their daily activities immediately. Alternative to traditional grafting. The pinhole surgical technique, developed by Dr. John Zhao, has revolutionized gum recession surgery by making it easier to treat multiple locations in one procedure. In contrast, traditional gum grafting requires several sessions to treat several teeth. With pinhole surgical technique, you can treat multiple locations in one appointment, meaning you can have your full mouth treated in one procedure. Additionally, postoperative pain is minimal compared to traditional methods. The main difference between traditional grafting and the pinhole surgical technique is that this procedure doesn't involve a donor site or harvesting tissue. The doctor simply guides your tissues into place with a tiny incision higher up your tooth. This method uses a tiny amount of collagen to give your new gum tissue the stability and strength it needs to grow healthy and strong. The process is quick and easy and requires no stitches, sutures, or any other type of anesthesia. Aside from the minimal downtime and no harvesting, pinhole gum surgery also helps you avoid the pain and discomfort of traditional grafting. There are no stitches or dressings after this type of surgery, and the cut will heal in a day or two. It may also take several sessions, but there's no need to worry about the pain if you choose this type of procedure. Just remember, it's important to take good care of your gums after any surgery, and you can avoid the risk of gum recession and other issues in the future by following the recommendations of your dentist. Because this technique is new, Dr. Kim's experience in PST/TM is extensive. He makes a pinhole in the receded area of your gums and then uses special instruments to move tissue into its natural position. As a result, your recovery is short and your smile is restored quickly. With this innovative method, Dr. Kim can repair your gums and restore your smile. Recurrence rate. Pinhole gum surgery is a highly effective treatment for gingivitis or receding gums. Although this procedure does require a small incision, it has very low recurrence rates. The procedure is often performed on patients who are seeking cosmetic gum treatment without severe dental problems. Patients who smoke or have active gum disease are not suitable for pinhole gum surgery, and it is not recommended for smokers or people with diabetes. There are many risks associated with the procedure, and patients should consider all of them before choosing a periodontist. Because of the risk of complications, patients must undergo an initial evaluation to determine if they are good candidates. Heavy smokers, uncontrolled diabetes, and patients who take certain medications are at greater risk for complications. Patients who have oral health problems or who smoke should also consult a periodontist before opting for this procedure. Pinhole gum surgery has minimal postoperative side effects, and the procedure doesn't require a lengthy recovery. For many patients, the procedure may be more effective than gum grafting, but it is important to remember that the surgery does not cure gum disease. Patients should be healthy, have no other oral health issues, and be in generally good health. Patients should consult a qualified oral surgeon and follow their physician's recommendations. While the success rate of PST is nearly identical to that of traditional gum grafting, this procedure may not be suitable for patients who have severe bone loss or receding gums. It is also important to note that PST has a high recurrence rate, so patients should be sure to follow their periodontist's advice before making any decision. The procedure is effective for patients with moderate to severe gingivitis, but the procedure is not suitable for patients with advanced gum disease or inflammation. Cost. If you have been thinking about having pinhole gum surgery but are concerned about the cost, you are not alone. Many people have problems with gingival recession that is exacerbated by stress. However, the costs of pinhole gum surgery are not out of reach. Most dental offices offer payment plans that you can choose from based on your budget and convenience. However, be sure to speak with your dental professional about any special financing options that are available. The cost of pinhole gum surgery depends on several factors, including the experience of the provider and the area of the country in which the practice is located. As with any type of surgery, the final cost depends on the extent of the procedure. Usually, the process takes from 1 to 2 hours. During the procedure, you are given local anesthesia. You should expect to pay anywhere from $1,500 to $8,000 in some cases. You should expect to pay anywhere from $2,500 to $5,000 for this procedure if you're suffering from gum disease. However, this price can increase depending on the extent of the condition that needs to be addressed. If you suffer from periodontal disease or other serious oral health problems, you can expect to pay upwards of $4,000. Pinhole gum surgery can also be combined with other procedures like dental bonding or crowns, which can further increase the cost. To determine the cost of pinhole gum surgery, the first step is to determine whether or not your dental insurance covers the procedure. Your dental provider will be able to provide you with an estimate of the cost. If you don't have insurance, he or she will be able to help you determine if you can receive financing through Care Credit. There are many different methods for financing pinhole gum surgery, so it's important to know what you can expect. Thanks for watching. Please like, comment, and subscribe.